Welcome back to AfyaWingu Healthcare Management System. In this video, we'll walk you through Section 7, Diagnoses, where you'll select and document the patient's primary diagnosis and any differential diagnoses using the official ICD-10 coding system. You're still viewing the record for Maxwell Wright, age 20, male, with visit date November 25, 2025. We've already documented his chief complaint, vital signs, history of present illness, medical history and safety, clinical assessments, and medications administered. Now it's time to assign diagnoses. At the top of the screen, you'll see the tabs again. We're now on 7, Diagnoses, which is highlighted in blue. Let's begin. Section G, Diagnoses. This section helps you assign accurate, standardized diagnoses that can be used for billing, reporting, and continuity of care using the global ICD-10 classification system. ICD-10 Search Panel, left side. This is where you search for and select diagnoses. 1. Search bar. Type at least 3 characters into the search box. Example, type MALA, system finds Plasmodium falciparum malaria and related codes. You can also search by disease name, e.g. diabetes, asthma, symptom, e.g. fever, headache, code number, e.g. B50. Tip, use common terms. The system will auto-suggest matches as you type. 2. Filter by category, optional. Below the search bar, you'll see trial filter tags like B50, code, diabetes, respiratory. Click these to narrow your search if needed. 3. Selecting a diagnosis. Each result shows the full disease name, e.g. Plasmodium falciparum malaria, the ICD-10 code, e.g. B50, a short description, e.g. certain infectious and parasitic diseases. To add it to the patient's record, click Set as Primary to make it the main diagnosis. Click Add to Differential to include it as a possible alternative. Example, if you suspect malaria but want to rule out other infections, set B50, Plasmodium falciparum malaria, as primary and add B50.8, other severe malaria, and B52, malaria with nephropathy, as differentials. Diagnostic impression primary. This box shows the main diagnosis you've selected. In this example, Plasmodium falciparum malaria, ICD-10 code B50. You can have only one primary diagnosis per visit. This is the most likely or confirmed condition. To change it, click the clear button next to the diagnosis. Then search and select a new one. Don't forget to click Save Information afterward. Changes won't be saved unless you do. Important reminder, when you clear or change the diagnostic impression or differential diagnosis, you must click the Save Information button at the bottom left to save your changes. Differential diagnosis. This box lists all possible alternative diagnoses you've added. In this example, other severe and complicated Plasmodium falciparum malaria, B50.8, Plasmodium falciparum malaria with cerebral complications, B50.0, Plasmodium malaria B52, Plasmodium malaria with nephropathy, B52.0. These help document your clinical reasoning, especially useful when the diagnosis isn't certain yet. To remove one, click the small X icon next to it. Again, after removing or adding any differential diagnosis, always click Save Information to lock in your changes. Clinical notes. Use this free text box to explain your diagnostic reasoning, why you chose this diagnosis, what ruled others out, or any special considerations. Example input. Patient presents with fever, low SpO2, and epigastric pain. Rapid malaria test positive. No signs of cerebral or renal involvement. Primary diagnosis, uncomplicated P. falciparum malaria. Differentials considered, typhoid, dengue, pneumonia. Tip, write clearly and concisely. This note helps other clinicians understand your thought process. Save your work. At the bottom left, click the blue Save Information button every time you add a new diagnosis. Change the primary diagnosis. Clear a diagnosis. Add or remove a differential. Edit clinical notes. The system does not auto-save diagnosis changes. You must click Save to record them. You'll also see Last Saved, November 27, 2025, updated by Malaika Center. This helps track who entered what, important for accountability and continuity of care. And that's it for Section 7, Diagnoses. You've now assigned accurate coded diagnoses, helping ensure proper treatment, billing, and reporting. Next up, Section 8, Management Plan, to outline the treatment plan, referrals, and follow-up instructions. Section 9, Prescription, to generate prescriptions for medications or labs. Each step builds a complete professional medical record, helping your team deliver safer, more effective care. Thank you for using AfyaWingu, making diagnosis documentation simple, accurate, and fully traceable.